Assalamualaikum students. Today we are going to discuss immunocompetence, deficiency of vitamins and minerals, total lymphocyte count, RBC, WBC, ferritin, hemoglobin. In hospitalized patients, micronutrient deficiencies are also present, and not only protein and energy deficiency or low level of energy and protein stores. Macronutrient deficiencies are mostly present in those patients whose the micronutrient or vitamins and minerals level are low before any disease, and the level or deficiencies are assessed by blood test, urine test, and or through physical assessment. Immunocompetence or immunocompetency, basically in case of inflammation, when depressed cell-mediated immunity, phagocyte dysfunction, decreased level of complement components, reduce mucosal secretion, and then assessing immunocompetency is also useful in patient who is being treated for allergies. Inflammation related malnutrition is associated with impaired immunocompetency. There is no single marker for immunocompetence for the clinical outcome of infection or allergic responses. Laboratory markers with a high degree of sensitivity include vaccine-specific serum antibody production, delayed type hypersensitivity responses, and vaccine-specific. In delayed hypersensitivity, this stress is not commonly used in clinical practices. Immune responses can be determined by an injection of a small amount of antigen intradermal, and the criteria for the responses can be differ for one and from one to another. A normal response is defined by sum of the positive responses to one or more antigen. So response to antigen in case of delay hypersensitivity is determined. Total lymphocyte count. For calculate total lymphocyte count, TLC, WBC white blood cell multiplied by percentage of lymphocyte divided by 100, and total lymphocyte count will be affected by presence of infection, trauma, stress, presence of disease such as cancer, HIV, as well as medication that influences the immune system such as chemotherapy. Some consider the size of responses rather than the number of positive responses, and normal responses, no responses, intermediate responses. When we said that no responses, the term allergy refer to the failure to respond to any antigen and maybe increase the risk of sepsis, and relative energy describe a response intermediate between normal and energy. So normal response, no response, intermediate response. Hematological assessment. The complete blood count provide account of cells in the blood and description of RBC. And evaluation of RBC can be important component of nutrition assessment and diagnosis of all anemia. Anemia may be due to iron deficiency, folate deficiency, uh, or due to any disease, chronic disease. Hemoglobin. Hemoglobin or Hb is a protein found in erythrocytes that function to deliver oxygen to cell and pick up carbon dioxide. Measurement of Hb is common in diagnosis of anemias, and in addition to nutrition deficiency, Hb may be decreased in those with hemorrhage, hemolysis, bone marrow issues or renal diseases and taking some medicine. MCV. MCV is a measure of the size of red blood cell and decrease in presence of iron deficiency, thalassemia, chronic renal failure, normal or decreased in anemia of chronic diseases, increased in presence of vitamin B12 and folate deficiency, genetic defect in DNA synthesis. MCH and MCHC. MCHC is a calculation of the amount of hemoglobin per unit volume in a single red blood cell, and the difference between MCH and MCHC is that MCHC measurement takes the volume or the size of red blood cell into the account while MCH does not, and MCHC decrease in those with iron deficiency, thalassemia, or not sensitive to any nutrient deficiencies, marginal nutrient deficiencies. MCH and MCHC reflect the average hemoglobin content of red blood cell. In MCH, express the average content, mass or weight of hemoglobin per red cell, and MCHC express the average weight of hemoglobin per unit volume of red blood cell, and MCAC decrease in those with iron deficiencies, thalassemias. A ferritin test measures the amount of ferritin in blood, and a ferritin is a blood protein that contains iron. And if ferritin level is low, it indicates low body iron stores and iron deficiency.